This is going to be a conversation moderated by Scott Kirsner with two guests. Jeff Ruiz is General Manager and head of the Diabetes Therapy Management Center for Medtronic. He's worked there essentially his entire career and is really interested in how to use new technology to move diabetes care forward. In last April, Medtronic and IBM Watson forged an alliance to be able to use the powers of Watson to push diabetes therapy. In that collaboration, he's working very closely with Deborah DiSanzo, who's general manager for IBM Watson, and we're actually thrilled to have you here this year. We've had representatives before from Watson. We really want to hear Deborah's perspective. Deborah, before this, was CEO of Philips Healthcare, and now in her role in Watson, she oversees 2,000 people who are working on various ways that computing, and Watson in particular, can influence healthcare in diagnostics, in therapy, and in a variety of diseases. If you would come up front, and the moderator, Scott Kirsner, is the long-term writer of the Innovation Economy section in the Boston Globe. I think this is Scott's third time. How many have been here 3 times? Raise your hands. Yeah, quite a few. How many first time? Okay, now we have to do the math to figure out how many second. I'm not going to ask. All right, so Scott, I think, always has his finger on the pulse of what's happening in innovation, in biotech, in general tech in Boston, and now he's quite interested in how large companies, pharma and other large companies, are using technology and moving that to patients. So Scott, if you would just take over.
All right, thank you for that introduction, Bruce. You know, being the journalist on the stage here, I guess I should mention the breaking news about Jeff is that he just got a promotion to Vice President of Diabetes Service and Solutions, so we should give him a big round of applause for that. I'll buy you a drink at lunch today as congratulations. So we want to make this session really interactive. We heard that maybe there were some sessions this morning that were not as interactive or people didn't have questions, so Sandy Fenwick says, anyone who works for Children's Hospital, your annual review is going to include how many questions you ask during this session. So keep that in mind. I guess the first question, you know, I'll get things warmed up. And seriously, if you have questions at any point during the session, just raise your hand. You don't have to have an index card in it, but just raise your hand. I can see pretty much everybody, and we'll work you into the conversation. So my first question is just, you know, the last thing I remember hearing about Watson, because I've been sort of out of the loop, is Watson made news initially in 2011 when it participated in Jeopardy, right? And it beat Ken Jennings and a few other people that nobody remembers, but it won $1 million at Jeopardy.
That's right, that's right.
Now Watson is a business for IBM. So like, what exactly is Watson when you explain to people at a cocktail party?
So explain to people at a cocktail party, say Watson is a really, really, really cool cognitive computer. What does that mean? And first of all, I want to tell everyone, this is my start of week 6 at IBM Watson Health, so we're just going to give that little caveat there. So Watson is a really cool, I don't think anybody at IBM says really cool, but I say really cool cognitive computer. What does that mean? It means that Watson learns. So Watson, when we saw Watson at Jeopardy, right, what was it doing? Watson had learned to read a whole bunch of information about pop culture and encyclopedia stuff that could let it learn. And what did Watson do at the end of that? It put up possibilities of what the answer was. And then Watson won. So who were the people who looked at those possibilities? They were actually clinicians and healthcare institutions who said, that's exactly what I do. I think I see an application for Watson in healthcare. And so the next thing that Watson did was Watson learned to talk. Now we're teaching Watson to see. And what can Watson see? Watson can see all the structured and unstructured text that goes into our electronic health records. We're teaching Watson to read images. We're teaching Watson to read more genomic data. And together with our great ecosystem of partners, we'll create applications to help patients.
Okay, and before you dive too much into the healthcare stuff, so is Watson a business for IBM in other verticals? Like, is there Watson for, predicting lottery numbers, or Watson for, financial services?
So of course, all I want to talk about is Watson Health, because that's what I'm all about. But yeah, so first, IBM created the Watson Group. And what are we doing? What are we doing in Watson? We bought the Weather Channel for the Internet of Things. And how can this exogenous data around us, like the weather, affect our health? But Watson is, in fact, a business, and we're doing other things. I don't know about that lottery number thing. I can't comment.
But better weather predictions.
It could be. Could be. Yes. Yeah.
Interesting. And so before we bring Jeff in, talk to us about Watson in Kendall Square and kind of this health team that you're building up.
How cool is that? How cool is that? So IBM first decides, hey, we're going to make an IBM Watson Health group in April, and then the next thing they did was they bought a few acquisitions in order to do population health and imaging and data better. And then for me, perfect, because I am a native Massachusettsian, they decide to build, we're building a building in 75 Binney Street in Kendall Square, right in the middle of all the biotech, health tech stuff. We're going to put 700 employees in it. What are we going to do there? First of all, Watson is not only a technology, it's a new way of working at IBM. People who are maybe a little earlier in their career than we are come to work there, create really cool stuff, open working environments, plenty of places to eat, plenty of places to have a cup of coffee, beautiful experience center that our clients and partners will come to understand really what Watson is about. It's very exciting.
And you said 700 employees.
700
staff up to. Where are those people going to come from?
Well, we're hoping they're going to come from Massachusetts, which is why we're right in the center here of health tech and biotech. Now, we have Watson Health employees in New York right now and in California. They'll come as well. But we have to hire a lot of people right here in Massachusetts.
But this is not a recruiting pitch, especially for
though.
Children's Hospital employees. Forget you heard that. So Jeff, talk a little bit about this partnership. Like, what was interesting about Watson to Medtronic?
Well, I'll start with, our passion in our diabetes business is all about how can we help patients better control their diabetes. And the one thing that I think has been a theme all morning is that not one entity can do it alone. And we know that while we're the world's largest medical device manufacturer, we're the leader in diabetes device technology, devices alone are not enough. And ultimately, and perhaps we'll talk about this a little bit later, as the future comes, the convergence of devices with data and analytics and the software to power that is what will exponentially increase the effectiveness of the devices. And this is why the partnership with Watson made sense for us.
Okay, and so talk about how you see, I feel like there is this vision for, obviously diabetics are kind of in the tip of the spear here in terms of doing active monitoring at home of their condition, but how do you see that monitoring and other devices that people might use, home blood pressure or a connected scale, creating data that is then going to be fed into Watson, and kind of what does that produce?
Yeah, sure. So I think the important thing to note is that when you're dealing with a chronic disease like diabetes, 90% of the care that happens by the patient themselves, in between the doctor visits. If a patient's fortunate, they'll see a doctor every 90 days for maybe 10 minutes. But it's really what happens in between that makes the difference in terms of whether or not they'll be able to control their blood sugars and avoid some of the horrific complications associated with diabetes. And so when you start going down this road of how do we better help and integrate, the more data and the more access to data we have, the more correlations we can find and see to provide the insights back to the physician, back to all of the providers, as well as the patients, to provide them not with just more data, but insights, guidance, recommendations, predictive analytics, so that we can see things before they happen. And that's already happening. We've already begun that work with Watson.
And give me an example. You sort of had a concrete example when we were chatting before about we'll talk in a second about how doctors are interested in seeing this information, but just the patient and the patient's family and kind of heading off potential crises.
So imagine a parent today that has a child with diabetes. Certainly the long-term complications of diabetes like renal failure and cardiac heart disease, amputations, all of that is certainly long-range concern. Short-term concern is a hypoglycemic event that can be fatal and can happen at any minute to any person with diabetes. And fortunately today, the devices have advanced to a point where our device today, if a child was having a low blood sugar, it can text mom and dad and let them know so that they can get to the child and give them some orange juice or begin to take some action to increase the blood sugar. So that's fantastic. And it's an exciting point that we're at in terms of the device technology. What we did with Watson right out of the gate was we did a study, taking all of the data that we have. We have 195 million patient lives in our database, patient days in our database that we've accumulated over the years. Watson was able to sift through all of the noise of the data, cluster patients into 6 groups, which helps it better reduce the variability of any prediction, and has the ability to now predict hypoglycemic events with up to 90% accuracy 3 hours in advance. 3 hours in advance, something the device itself could never do, something that nobody could ever find the correlations by looking at one patient at a time, but now Watson serves that up to us, and now we can provide those insights to doctors, ultimately getting it in the hands of the patients and the parents, so that now not only would you not get notified when it's happening, you'll get notified way in advance so it never has to happen. It's a real world application that we're working on right now.
Okay, so Deborah, you've been in the job for a month and a half now,
Right,
so I
yeah.
expect you to handle the tough questions.
Yes, exactly, yeah. Here
I
we
know a few MDs and even a few at Children's Hospital, and the thing I would observe about MDs is that when they're in the office with a patient, some of them believe that they are the smartest person in the room.
And they are.
Some.
They are, yeah.
So what challenge does that create with Watson for you to say, okay, there's going to be this software in the office with you that's trying to do predictions about what may happen to this patient in the future, trying to serve up information that maybe you weren't aware of about how adherent they've been with medication or what their blood pressure has been doing over the last 6 months. Talk about how you see Watson fitting into that environment, and we'll have a follow-up. But let's talk about that first.
So let's just back up a minute, right? So here we are sitting here in 2015, and the beautiful thing about this time is these 195 million patient days that Jeff talked about, we never used to be able to get that type of data in a database. In healthcare, we have all of this data in these disparate databases, and it's all locked up. The first notion that we have to say is, if you can get that in a place, in a significant database, and you can democratize that data so people can have access to it, and you can anonymize it so that you don't know that it's this particular patient or that particular patient, but you know what happened to that patient, all of their history, you know what happened, then what can you do? What will this unlock in healthcare when the physician, instead of having to sit in his office with the 7 minutes that he gets with you, right, the 7 minutes, instead of scanning through the electronic health record himself and trying to make correlations himself, what if something could do that for him? What if something had the benefit of learning this vast amount of data and looking at this particular patient and then can say, hey, Dr. Scott, how about if you look here first? I mean, so don't think of it as a piece of software. Think of it as really an aid that in the future physicians will have that will enable them to take care of their patients better. Today, we're starting that. Today, the work that Jeff talked about in diabetes is the start of that. How can we get the data collected? What can Watson learn from it? What, with the human Watson interaction, insights can we have? And then how will it help the patient? How will it help the physician?
And how do you, can you raise your hand if you're somebody in the audience who sees patients or interacts with patients in an office setting or an acute setting, and keep your hands up if you're excited about learning a new piece of software or going to a 2-day training. All right, this is the early adopters because there's still some hands who really love it. So how do you see that? How do you see Watson physically? This is just a very detailed question. Do you have a vision of how Watson, is it another piece of software that doctors are learning and interacting with? Is it built into like Epic or a medical records system?
We have, so Jeff said a beautiful thing. He said no one company can do it alone, and this is the importance of what we say today. In our healthcare situation where we are today, no one company is going to solve this together. So the other beautiful aspect of Watson is that it's really about an ecosystem, and it's about what can our ecosystem partners build on top of this data and these insights. So we do have Epic as one of the ecosystem partners as well. What will Epic use from insights of Watson to help the interaction with the physician and that system work better? CVS Health is an ecosystem partner. So you go into the Minute Clinic, right, and you get a minute. You get a minute with that great physician sitting there. And how can Watson, with our Care Manager platform, Population Health, really help that physician take care of the person that maybe this is the first time they saw them? What insight can it give? So it's not all about IBM, and it's actually not a piece of software. It's about an ecosystem of partners using the data in Watson, and Watson deriving insights from it that's going to help the physician and help take care of that patient.
I think, Scott, also the answer to that is that it can't be one defined answer. It has to work within the environment that the providers are working within today and that patients are living in today. So in the case of bringing the patient to the center of the equation, if there are insights that need to go to a patient, it's got to happen in the way that patients are going to access it.
Yep.
Watches,
Exactly.
phones.
Exactly.
Gone are the days of the website portal. We all know this, right? So we have to evolve, but the capability and the way that we're building the solutions in an agile way to be able to get it to the right place at the right time in a form that people want to use, that's the challenge for us commercially to make sure that we meet the needs of the end user.
And can I talk, because Jeff just mentioned watch, and we're both wearing our Apple Watches, advertising for, but can I talk about, so IBM just announced to our employees, because it's open enrollment time, right? So if, for our employees that sign up for a particular health plan, they're going to get a discount on Apple Watches, and on the Apple Watch is going one of our ecosystem partners, WellTalk. And what that will do is enable the IBM employees who are generally healthy, right, walking around healthy, but how do we stay healthier? Remind us to get out and exercise, remind us to pick up our prescription at CVS Health, remind us to not eat that lasagna and drink that beer. That's a particular problem my father has. But really to help us take care of ourselves better. So Jeff said it, how do we interact with the healthcare system? How will we do that? And how can Watson and the ecosystem of partners play into that?
Okay. I'm not going to test you while you're on stage, because I know that there are some people now that Apple Watch is such a status symbol, but kind of has limited utility, that some people don't even bother recharging it, but they do wear it just as a fashion.
I recharge it every night.
I am charged.
And if somebody calls me, I can actually talk to you. Yeah. So yeah.
All right. I don't feel the need to wear one as a fashion statement.
But you could get a green, like.
Yeah, I think there is a green band.
Yeah,
I should get one of those.
Yeah.
So I just want to ask one more question and then open it up to your questions. But let's talk about whether it's wearables or other trends. What do you see? We're here in November 2015. What do you see as being big health tech trends for 2016?
I will go back to the convergence of devices with data and ultimately the different solutions that can be built off of that to provide better care and insights. That's only going to continue to accelerate. And the great news is it's going to accelerate what we're able to do from an outcome standpoint. In getting that information, the right information in the hands of the patient, the right information in the hands of the providers so that everybody can better manage, and particularly in the world of chronic disease where it takes day-by-day management.
But so you don't disagree that I feel like, in a way there's a gulf where you have a lot of consumer devices that are generating data now, and then you have all the data, imaging and, lab test results that's in my EMR, and there's kind of still a gulf between those two, right?
There is a gulf, and I think through the partnerships like with Watson, one of the major things that we're doing is leveraging IBM's capabilities and technology and infrastructure to get the data consolidated. We as well, even internally, have different sets of data that we need all together so that we can start matching things and seeing things and finding the correlations that exist even within our own world. And Watson is playing a very important role in that through some of this consolidation. But all of that will have to continue to progress. There's no question in making these connections. And I think every researcher and every provider in this room would say that if we could connect some of these different aspects and systems together, we would be able to see more important things than we do today. And this is exactly what we're trying to do.
Can I just say, too, that I love when Jeff points to me and says Watson, because it makes me seem like I'm really a lot smarter than I am. But you know, just to feed off of that, the exogenous data that you talk about, the weather, really, the air quality, the activity monitors, all this information is actually a lot more important to it. I made a joke about my father, who has diabetes and has a propensity to eat lasagna and drink a beer, and then the next day says, "Oh, I feel horrible." And the thing is, with the large deductibles that now patients and consumers have, and the cost of healthcare, really what we will see in 2016 is a continuation of patients really wanting to be very involved in their health, And what will allow them to do that? I think they are going to put more of these devices on themselves so that they can find out what's happening to themselves. Luckily, another one of the ecosystem partners of IBM Watson Health is Apple. So HealthKit and ResearchKit, the information that goes into HealthKit and ResearchKit will be part of this democratization of data, so that, you know, could you see a time at one point when the electronic health record data is combined with genomics data, is combined with this exogenous data that comes off of our activity monitors? Yes, you can, not that very far off. And when we get that together, what are we going to be able to do to help take care of ourselves better and to help our physicians take care of us better?
Yeah. I'm thinking about, like, what is the sensor that would be able to know about the lasagna consumption? You know, is it like a connected refrigerator? Is it a connected microwave from Amana?
I think there probably is something. Somebody out there probably knows about it.
Sorry, it's what? A sensor in your shirt that would know about lasagna stains? Oh, in your mouth. Okay. All right. I don't know. There's a startup idea in there somewhere. I'm curious if you have questions about kind of where the rubber meets the road stuff, about how Watson actually shows up in the world of, you know, academic research institution or a doctor's office, or other stuff that we've been talking about. Remember what I said about Sandy and the performance reviews? Oh, yeah. All right, good. There's an A student in the front row. Go ahead. Actually, wait for the mic so everybody can hear you.
Thank you. This is a follow-up to the lasagna question in some respects. As hospitals become accountable care organizations and take on more risk from the payers in terms of the reimbursements that they get, how do we share that risk with the patient to make sure that the patient's taking their medication on time and that they're not eating lasagna when they shouldn't be eating lasagna? How do we really democratize all of that part of the healthcare world so that all the risk isn't on the hospital?
Well, that's a good question, and I'm not sure we are the ones to solve that problem. But it's a fair question. There's no question that the risk is moving across the healthcare system to all sorts of different partners that are all starting to look actually very similar in a way. But I agree with you on the hospital side. Moving the risk is a challenge, but enlightening the patient to better self-manage is, I think, a critical part of the solution. And we are actually working with IBM on another key initiative that is actually going to work with patients upon discharge with diabetes, engage them, give them some of the devices that we think will provide us insights, see the data, remotely encourage them, motivate them, coordinate the care with the physician, track them, et cetera, and we can incent the patients along the way to make better behavior changes so that they can take on more of the responsibility that we need them to. And we're looking at all sorts of the psychosocial aspect of the treatment of diabetes and how does that play through some of our overall technology and overall device solutions.
And you know, we do have data now that shows if you give information to the patient that they can act on they will act on it. So for example, a study came out recently that showed that people who actually, using their activity monitors, actually get up and walk every day and do their 10,000 steps or whatever it has, they are actually healthier than the people that go out and exercise 3 times a day. Now, why are people walking their 10,000 steps? Because you're giving them the feedback. So the thought is, look, we're going to have to do this. A study was done a few years ago on the sustainable healthcare systems of the future, which showed that patients are going to have to take responsibility for their health, or else we're not going to be able to get through this. So how do we help patients take responsibility for their health? And I think it is with giving them the feedback that they can act on, whether it is not to eat the lasagna or whether it is to stand up and get walking. And there's research showing that patients will do that. So what will people invent in the ecosystem? What will people invent when they have a database that they can access and derive insights from? I think a lot of really cool stuff. A lot of really cool stuff.
All right, we'll go to the B students in the second row. Yeah, go ahead. Bring the mic back here.
How much of a factor is health insurance and health insurers in this? You know, do you see where patients may be reluctant that if they're sharing all this data, something may show up that may make it difficult for them if they wanted to change jobs or to find new insurance to get coverage?
So I want to say firstly that you know, both the providers and the payers and taking care of patients' health are very important. I'm not going to take a point of view on that. I am going to take a point of view that the data inside the Watson Health Cloud is anonymized, so that it's there. It is there not to point to Jeff and his you know, whatever his health thing is. It is there for people to develop applications and apps and insights that are going to help them deliver care to their patients better. Whether that be, you know, Boston Children's, we have this fantastic open pediatric relationship with Boston Children's, what information from Boston Children's goes into this thing? It goes in all the medical literature of how to care for children, and then through social media, through online learning, through videos, that information that Boston Children's has can go out to other parts of the world where children don't get as good a care as they have in Boston Children's, but have access to it. Now, that has nothing to do about a particular patient's record or their insurance. It just has to do with what can you do with a database of anonymized information that people can access and do cool things with.
It also feels like it's going to be a societal question about, do we want to penalize people, whether they're a driver or whether they're a patient, for bad behaviors? You know, there's stuff going on in car insurance now, like an increasing wave of like, hey, should the good drivers be subsidizing the bad drivers, you know, and the people who run every yellow light, and, you know, every stop is a rolling stop. And it feels like, you know, it winds up being a societal question of, do you want to sort of slice and dice people based on their behavior or not?
Yeah, I think also over time, we all are getting a little bit more comfortable in this area. I remember the days where I wouldn't give my credit card to a site like Amazon, and today I couldn't live without having my credit card on Amazon. It's just so easy. So, I think these things evolve.
But then it's funny, like every once in a while, Amazon will get bad publicity because, you know, they will do these tests that say like, hey, we realize you're actually a different demographic than, you know, somebody up there, and you would be willing to pay $1 more for that product, you know, and they'll do tests like that. And then the media gets up in arms and saying like Amazon is now customizing prices based on people's willingness to pay.
But at the end of the day, you know, we and all of us have to be able to provide value in exchange for the risk that someone takes with that. So to the extent that Amazon provides me enough value, it's worth the risk. And to the extent that we, through our solutions, are able to provide enough value, then people will be willing to provide their information as long as it's not being used against them, as you say. You know, look, I think over time, I think all of us will be more comfortable in this area, but we also need to make sure that we have the right protection for the patients, all of us included in that room.
We have lots of examples of patients who are providing their healthcare data. I just read a study that congestive heart failure patients feel completely okay with allowing access to the data. All the people who are on activity monitors and have friends and everybody can see how they, people are going, all the social media we have. If there is, as Jeff says, a point to it at the end, if it is going to let us lead a healthier life, if it is going to let us, have the equivalent of buying our tea in the morning because we put an app on our phone, if it provides the value back, we're seeing that patients and consumers are doing it, yeah.
Other questions? Oh my gosh, there are a lot. You guys are taking this threat seriously. There's a microphone up there. Go ahead.
My question has kind of two parts. One, are you seeing any difference between type 1 and type 2 diabetes in the sort of the Watson information and the work that you're doing? And then secondarily, in the type 1 patients, are you doing anything specific around behavior change? You talked about a study that you're doing around, that has some behavioral change pieces. Anything specific that you can comment on about that?
Sure I will. There are clear differences between type 1 and type 2. Medtronic our devices have typically been focused around the area of type 1 and type 2s or who are on more intensive management. But our vision is to transform all of diabetes care, and so we are, as quickly as possible, broadening into the world of type 2. We have not done any work yet specifically in the world of type 2 with Watson, but we will. And the second part of your question was around behavior change. Thank you. And so, yes, so, the same question that we were just referring to a little while ago, at the heart of all of this for diabetes is, in fact, the patient level of engagement. And you can have the best device, you can have all the greatest medications and everything, but if the patient doesn't take it and the patient doesn't take care of themselves, it's all for naught. It really is the 90% of in between that makes the difference. And so we absolutely understand the aspect of making sure that patients are engaged, they understand, they have the information they need to make the right decisions, they have the motivation to make the right decisions. And part of all of our solutions, whether it's some of our remote coaching programs that we have for the patients that we support today, and through the technologies, we span the gamut of trying to find some of the keys to crack that code, whether it be things like gamification within digital solutions, profiling, understanding the psychological profile and preferences of patients along the way, understanding what their needs and desires are and what their motivations are before we try to jump into a particular way of helping them solve their problems. So it's a very important part of what we are doing today, and very interesting evolution if in the history of kind of Medtronic diabetes as we think about holistically trying to help patients better manage their diabetes.
It's a very important part of Watson too. So we announced in September another one of our partners, CVS Health, together with Fitel, one of the companies that IBM now owns, in creating a care manager package, which actually has this right at the heart of it, and that is how do you help patients suffering from chronic diseases like diabetes or others take care of their health better. And when you talk about patients taking care of their health better, that has to involve behavior change.
One follow-up for you, Jeff. So when you talk about the coaching and what you find worked, is that typically so like phone-based coaching? Or are you doing some like video Skype type coaching? Or
we actually all of the above. So we actually have a network of certified diabetes educators that are spread all across the country that help patients in person at the local level. We have remote coaches that do some telephone-based work, and we've begun doing some video work as well, and bringing that all together through kind of a digital solution for patients to help them better self-manage and to help us help them along the way.
Cool.
Yeah.
Let's see if we can get in a couple more questions. Let's go into the middle here if there's a mic that we can hand over to you. And then who else wants to get questions? There's one over there and one on the far side.
She's been
All right,
amazing.
great.
Go
ahead.
Thank you. So conceptualizing the involvement of IBM Watson in precision medicine, which is inherently a field that requires such a high level of specificity and customization, what role or what responsibility do you think IBM Watson should be held to from the health field, from medicine, because of its predictions?
So I want to be clear. I want to be really clear. So what does Watson do? Watson reads. You know, we were just talking about a particularly rare pediatric disease before I came in here, of which there are 240 studies written on this particularly rare disease. So what would Watson do there? Watson would read those 240, 250 studies and understand the connections between those studies. If a human, a human could probably do this. A human could sit down and read 240 studies and maybe in their mind make those connections, but Watson would be able to do it faster. Make these connections. Then what would Watson do? Perhaps if there was a database of patients with this rare disease as well, Watson would be able to find the connections of what treatment was done to the patient and the outcomes and make those connections. What Watson is going to give then is not a prediction. What Watson is going to give is a possibility. Here are the 3 likely possibilities that come up when talking about the best care pathway to treat a patient with this particular genetic makeup, with this particular gene sequencing. Here's the possibilities that we see. Watson isn't going to predict. Watson is going to aid one of our very fine clinicians here at Boston Children's Hospital. It is an aid for the physician to take care of their patients better. And so what responsibility do we have? We have the responsibility to be the best cognitive computing power in the world with a significant database, which is going to allow us to make those connections to the clinicians.
And then as we leverage that database, I think it does then begin taking it down to the level of precision medicine. If you think about diabetes, it's an epidemic. It's not a rare disease, but it's individual and it's individualized, and every patient is different. And the factors that impact glucose on a minute-by-minute basis are our activity levels, our stress levels, the food, the medication intake, the level of insulin, et cetera. That's all very individual. And we will be using the capabilities of Watson to then create these dynamic care plans with real-time data going on so that we can provide insights and recommendations to a patient at their level in terms of what they need to do. So I think it does very much crossover beyond rare, but into specialized patient-by-patient care.
Thank you.
I thought you were getting to will attorneys be able to sue Watson for malpractice? Your question was going. Is there someone with a question over here who has the mic or is near the mic? Yeah.
Yes, I have a question about the regulatory approval process and the role that Watson may play in that to analyze both safety and efficacy data. So do you envision a day in the future when Watson would actually have a seat at an FDA panel meeting?
I don't know, but we were talking, I was talking this morning with one of my colleagues at Boston Children's about the role that Watson could play in safety and efficacy, and I think it's definitely something to look at. I'm not going to make a mention about the FDA panel, but there is an awful lot of data that goes into that, and collecting that together, deriving insights on it. I think we could find something. I mean, we're already there are companies today. Our partnership with Teva is in how can Teva use Watson to help with real-world evidence to speed up drug discovery or drug repurposing. And that is all about safety and efficacy, and that could be applied other places as well.
And the federal government is such an early adopter of technology too, right? FDA is the first door you'd knock on, I'm sure. Go ahead.
Hi, my name is Dan Nygren. I oversee IT at Children's Hospital, but I'm also a pediatric endocrinologist and a type 1 diabetic, so I'm interested on multiple levels. My question is, Scott, you just joked about, well, will lawyers sue Watson? There's been discussion about Watson advising, but I think we really are at a juncture where software could reliably play a role in providing care, if you will. We have, insulin infusing pumps, we have continuous glucose monitors. This notion of connecting the loops and thinking about an artificial pancreas this is not science fiction anymore. And I could envision that using IBM and Watson to do a lot of analysis of those data patterns, and as you suggested, being able to predict in advance things that are potentially going to happen to a patient, that we're not far from having a self-contained system with devices and intelligent software within. So is that places that you guys collectively are thinking about going?
Yeah. Would you like me to take? I will say yes.
Yeah.
In fact,
That's a good answer.
specifically as part of our announcement in our strategic partnership, we are working in one arm of our relationship specifically around the algorithms associated with the artificial pancreas, just as you so greatly described, and closing the loop of now today we have the technology to understand what the glucose is at any given moment, and we can deliver the insulin and connecting that so that the patient doesn't have to worry about it on a minute-by-minute basis any longer. That is the ultimate goal of Medtronic Diabetes, as I'm sure you probably are well aware. The challenge in that is the algorithm associated with it, because that algorithm has to be dynamic and it has to understand each patient's unique characteristics, all the things I mentioned earlier and their own metabolisms, et cetera. It's a mathematical complex challenge, and specifically we're working with Watson to accelerate our advancement in the closed loop project.
Thank you, Jeff. But I do want to say that I stopped short of saying, really quite short of saying that Watson is going to deliver any sort of medical care. What Watson will enable, I mean this significantly, really, what Watson will enable is clinicians to take care of their patients better. Because the amount of data that's coming at us now, some predictions are the amount of medical data doubles every 2 years, others say 3, others says 4, whatever it is just a gigantic amount of information, and it becomes more difficult for clinicians to sift through that data and to make those insights themselves, as well as to go back to data that may have been generated a decade ago or 5 years ago, but we didn't have it in a place that insights could be made. So I think where we should think of Watson is in assisting in that clinician taking care of their patient. If I could just give just one more example, is that if IBM announced that they bought Merge, which is a vendor-neutral archive of radiological images, 30 billion images. IBM bought that so Watson can read through the images and learn from the images. If the only thing that comes out of that, if the absolutely only thing comes out of that is Watson can help a radiology department better triage what images should be looked at first, we won, because we'll save patients' lives that way. That isn't Watson being the radiologist. That's Watson saying, hey, look at this image first because this might be your most critical patient in your stack. So that's not Watson being a doctor. That's Watson helping a doctor do their job better.
All right. Thank you so much. This panel was really informative and terrific. Thank you.
Thanks, Bruce. Thanks, guys.